Hi, this is week 6, Intimate Partner Violence for Chapter 9, and Stephanie, Amori, and Sherry are your moderators for this week. So, intimate partner violence is any behavior within an intimate relationship that causes physical, psychological, or sexual harm to those in the relationship. According to Burgess, and most of these slides, unless I indicate different, are from the Burgess text. This is a summary from the Burgess text for the information that we need to know this week. So, intimate partner violence can be any of these four: physical, psychological, forced sexual intercourse, or really any other controlling type behavior. The scope of the problem is revealed in some of these statistics. Between 2001 and 2005, 22% of violent crimes were against women, 4% of those crimes against men. 38% of children lived in homes where women were victims of intimate partner violence, and 21% of those were male victims. 42% were non-fatal cases. The National Crime Victimization Survey stated through Burgess, this was research done by Cataloni, more than 50% of domestic violence calls have children under the age of 12 years. These are some statistics, and again, we're not gonna read these slides to you because you can all read, but just the impact, statistical impact of intimate partner violence. Women that were killed by their spouse, boyfriends or girlfriends killed through intimate partner violence, 19% were killed by a family member. And then the statistics there, 99% committed of women that were assaulted committed by male, and 83% of the IPV against men that were committed by male offenders. Again, these statistics are all this information is through the Burgess text. This is race, some statistics as far as race, black women over white women, and then also male homicide victims. And again, you can read these. Same author, Cataloni, with several other authors. The World Health Organization really did the first study, in-depth study on domestic violence. That was the term. Again, there's several terms here. In the past, we've used wife battering. Now, used to be domestic violence, and now we've transitioned to intimate partner violence as far as the wording there. 24,000 women from 10 countries in both urban and rural areas were in this World Health Organization study. Women assaulted or raped by a stranger or acquaintance, and women are at greatest risk for violence in their homes versus on the street. 25 to 50% of women were victims, assaulted either by husbands or partners, and did sustain physical injuries. 20% of the women reported physical violence but never told anyone. 4 to 12% were pregnant and abused by the unborn child's father, and 50% of these women reported being punched or kicked in the stomach. So I guess the assumption there is that the abuse was in an attempt to maybe abort the child or kill the child. Burgess also discusses, according to the CDC in 2006, about dating relationship type violence. 1 in 11 adolescents were victims of physical violence. 1 in 4 adolescents report some type of IPV, verbal, physical, emotional, and or sexual every year. 1 in 5 high school girls were victims of physical or sexual abuse. 70% are girls, 52% boys, and then 8% boys and 9% girls of these that are reporting have been to the emergency department for some type of physical injury. Legal perspective on IPV. One approach is mandatory arrests and charging the batterers. There was an experiment that categorized three different outcomes: either arrest, sending him away from the scene for an 8-hour period to give the victim some relief, or giving advice or mediation as part of solving the problem. Results of this experiment showed that arrests were most effective in reducing IPV or DV. I will use those terms interchangeably throughout this presentation. Unfortunately, victims were subject to concepts of court if they refused to testify, or perjury charges against those if they changed their stories. So we all probably are aware of some of the history with DV and how we've evolved from working to help the victims versus re-victimizing them. Another approach to help increase safety was to utilize protection or restraining orders. These were more effective than prosecution because it protected the victim and prevented retaliation from the batterer if they were being criminally prosecuted. This was a deterrent for the offenders, although 23 to 50% of the offenders re-victimized within 2 to 4 months. So again, not some good solutions here, but not the best solution really. According to the FBI in 1995, 50% of DV homicides were from firearms. In January, there was a bill, January of 1991, a bill that was passed to prevent domestic violence offenders with restraining orders from purchasing a firearm. And so, again, moving in a good direction, learning probably from past bad experiences. This bill also required law enforcement agencies to report DV restraining orders to a central database. So if people are moving around or even from one city to another, that information can be followed as far as guns and the arrest charges. DV misdemeanor gun ban prevents anyone convicted of a misdemeanor of DV or child abuse from purchasing a gun. Again, this information is all from the Burgess text. Child abuse, a little bit here about the correlation between child abuse and domestic violence. It was recognized that children in a home are exposed to DV, and this has been categorized as a form of child abuse. The largest portion of children exposed to emotional abuse in a Canada study. Again, our Burgess book does a good job of talking about U.S. laws and bills and research, and then also Canadian. Child Welfare Services agencies determined if an abused parent was held responsible for exposing the child to violence if they chose to stay in the home of the abuser. If there's abuse going on and the parent was staying in the home, then they could potentially, the victim, be charged with child abuse. So women were torn between the risk of losing their children if they left or if they disclosed, or continuing on with abuse and not reporting or getting help. Battered women syndrome is one of the first theories. Lenora Walker in 1979 first introduced this term or this syndrome, and it's one of the first recognized as far as the cycle of battering, and really encompass 3 phases here: the tension reduction phase, the acute battering episode, and then back to the loving attrition phase. And you can read about these in your book. I was looking here real quick to on page 299 in your Burgess book. It walks you through these. And again, I'm summarizing this and letting you read to get the details for more information that you're not aware of. So to be categorized, according to Walker, to be categorized in the battered woman syndrome, a woman must experience this cycle, 3-phase cycle, at least twice before they're considered in that syndrome. And the women really become under just total control. Their experiences are undermining sense of self, isolation from friends and family, financial abuse. You can see the thread through here by the batterer to get the women really dependent. It's about dependence and control and power type scenario. Monitored, oftentimes telephones are monitored. Like I said, relationships are monitored. They really are, I call it brainwashed, but just told that they're an inadequate parent, inadequate lover, unable to think on their own, unworthy of love or, being with anybody else. And so that kind of brings them, they get battered and then back to that loving relationship where the abuser or batterer will take them back and cherish them oftentimes with gifts and things like that, that they love them. There's with this syndrome a learned helplessness. Again, like I said, a pattern of control and abuse. The victims learn to accept abuse as just a way of life and become very passive in an effort to avoid the abuse stage, and also, then are cherished with love after that. And so that fosters their feelings of helplessness. They really don't believe that there's any way out of that situation. They take the positives that they can in the relationship and then just try to avoid and put up with the abusive stages. Their emotional well-being is severely altered and they're very vulnerable to depression and anxiety. Post-traumatic stress syndrome is another disorder that victims often experience and really is categorized along with the battered woman syndrome. And this happens from symptoms of re-experiencing assaults. They have dreams of the assault, flashbacks, intrusive thoughts, just really become numb and inactive. Constant anxiety, kind of a hyper aroused state all the time, in anticipation, not that they want it, but wondering when the next abuse stage is going to happen. Long-term abuse is difficult to determine the extent of the impact, again, due to that total control. So they never know when the abuser is going to kind of fly off the handle. A lot of loss of faith, hope, desperate isolation and withdrawal, distrust, altered perceptions of themselves, as well as the perpetrator and really anybody else. They just have a sense of they can't trust anyone. So what are the barriers to disclosing and how do we end abuse? We know a lot about IPV, but don't always know exactly how to stop that. Lots of research. Battered women stay in these situations for a variety of reasons. One of those is individual factors, and these are explained on page 301 and 302 really of the Burgess text. The individual factors are that they're fearful, they have post-traumatic stress, they have that love, they go through that one phase in the cycle of love and commitment, really become resilient and feel like they're able to protect themselves by the actions. If they act a certain way or they can figure things out, they'll be able to stay. Some of the family and cultural factors that influence a woman to stay in these abusive relationships. They don't want to bring shame to their family. Oftentimes they have religious or cultural beliefs about the family unit and the fact that you need to stay married or you need to be a devoted wife. They're concerned for their children. They may believe that abuse in the relationship is normal. If they grew up in a home, maybe where there was abuse, they think that's just how it is. Community resources or services often challenge disclosure and ending of that abuse, what the Burgess calls as social entrapment, that we don't have good absolute reliable community services that help them get out of these situations. So, housing options for domestic violence victims are minimal or really lacking. Limitations in education, opportunities for employment oftentimes are not there. Insufficient counseling or shelter resources to be able to have them get away, be safe, and then really have the finances to be able to start their new life. Social policies also influence these. Women feel trapped because of immigration laws that might be there, social welfare and housing policies that are disadvantaged to them because they have been isolated and don't have employment, don't have a credit base. They maybe are single mothers and don't qualify. The mandatory reporting policies through welfare related to children being in an abusive situation, just lots of social policies that we have that oftentimes work against encouraging their disclosure and helping them get out of the situation. Some statistics here, again in the book, the Burgess book on IPV in same-sex couples. Males up to 50% occurring in males as well as females. Lesbian relationships are typically women who are involved in violent heterosexual relationships. Patterns of abuse, when we talk about IPV, it's just very similar, whether it's a heterosexual or a homosexual or transsexual, whatever type of relationship. Laws that protect intimate partners are typically for heterosexual couples. So again, some of these things that we talk about, you may want to bring up in the discussion this week, how they vary specific to your state. And typically, evidence has shown that police ignore standards of DV procedures related to same-sex IPV. I think we're really lagging in the whole IPV area. But then also when you put any kind of differential factor in there, it throws people off kind of another step. Again, back to children witnessing along the same lines that we talked before. Studies have shown that children from an IPV family are more at risk for physical abuse, neglect, sexual abuse, or psychological violence. Batterers, that control an adult partner also oftentimes control and intimidate children. And if they aren't being abused themselves, they're witnessing the physical abuse of their parent. Children that are exposed to abuse are not exposed, actually abused, but witness also have similar depression, anxiety, social withdrawal, hyperactivity, aggression, low self-esteem, poor school performance, just kind of the whole gamut of psychological issues. Just as much as witnessing, even if they aren't abused themselves, from being in that environment and witnessing the abuse going on. PTSD symptoms here, 13% develop PTSD, 50% have at least one symptom. And studies show that children are exposed to parental IPV show 30% had outcomes similar or better or no better than non-witnesses. So comparing children not in an IPV family situation versus being in a situation. Kipman and colleagues were authors to this research study. Children are more likely to become a perpetrator themselves when they grow up if they're exposed to that versus being abused as a child. They're more likely to become a perpetrator if they're exposed to DV versus just being abused, I guess, in other ways. Studies have shown that men were 3 times more likely to become an abuser if they're exposed as a child. And combination of child abuse themselves and witnessing abuse multiplies or works together to increase the risk for IPV later on. This is another study of 501 battered women from a variety of settings that showed with women with higher education and less commitment to relationships were more likely to leave. So what they're saying here is victims with higher education were at a lower risk for IPV and also enduring an abusive relationship for a longer amount of time. Victims with low education, um, low, low education or low self-esteem tend to stay in an abusive relationship longer. The book goes through, starting on page 306, some of the batterer typologies, and there's several different authors here that will talk about kind of classifying the typologies of batterers. So there's a clinical and a theoretical type of typology, looking at models and grouping. The first one that the book talks about and talking about here is Elbow, by the author of Elbow in 1977, looked at 4 patterns of behavior in batterers: the controller, the defender, the approval seeking, and the incorporator. So dependence again, or controller again, is a partner that controls. Defender is expecting the wife to love and forgive him no matter how much he abuses her. The approval seeker is one who is insecure that he cannot tolerate the rejection implicated if his wife leaves, and then he threatens her if she leaves. And then the incorporator is one who sees his wife as an extension of himself and often threatens violence because her leaving is such a threat to his ego. Another author Gondolf in 1988 looked at the psychopathic batterer, the antisocial batterer, and the typical batterer. So again, psychosocial would be physical and emotional. Antisocial was more of a violent verbal and physical abuse. And then the typical is a less severe kind of combination of either one of the above. Holsworth, Monroe, and Stewart looked in 1994 at the batterer typologies. They actually are classified, if you look on page 307 and 308. There's a nice chart on 308, kind of how they operate. Looking at family only, this is the least marital violence, the lowest level of psychological and sexual abuse, least violence outside the home, and violence usually results as a combination of stress and other risk factors. There's a lack of generalized hostility towards women. The dysphoric and borderline is more moderate to severe abuse. There's not a lot of out of the home violence. Most psychologically distressing, oftentimes background of parent abuse and rejection, and they're most likely to show borderline characteristics. So unstable personal relationships, fear of rejection, jealousy, and then the generally violent antisocial. Just by the wording we can tell it's more moderate to severe levels of violence, highest level of extrafamilial violence, most likely to have antisocial disorders, so criminal arrests or record substance abuse, and they're more deviant with their peers, more generalized use kind of in everything that they do for aggression. Bender and Roberts also use the Holdsworth, Monroe, Stewart, and then Gondolf's categories to determine their theory, and so they look at really levels, level 1, level 2, and level 3. They are categorized, a nice chart on page 309 of the book, and again kind of go from short-term violence or lower level to an intermediate, higher level, and then the third level is a long-term, more violent abuse. Generally, the violent antisocial abuse is the most severe level, up to level 5, and homicide. So from level 1 to level 5, I think I said level 3, but it goes to level 5. From least violent to most violent, categorized as with homicide kind of as the worst end scenario. And that leads us into spousal homicide. Spousal homicide in IPV is very common, unfortunately. Canadian research showed spousal homicide was a main contributing factor to the number of homicides, and 17% for Canadian research in 2006 were murdered by a current or former spouse. Again, this information is from the Catalona Lono et al. 2009 research. Also, the synopsis is in the Burgess text, or you can look up these authors' their own research. Again, this is Canadian research from 2003 to 2005. I'm not going to read these to you, but you can kind of look some shocking statistics there. Youngest person killed was a 15-year-old. The oldest was an 89-year-old. So we can see that it's all age groups, really, as far as relationships. Stabbings, firearms, beatings, strangulations, a multitude of different ways that people were murdered. Campbell and colleagues in 2003 did a study of 220 intimate partner murders in 11 different cities, and the risk factors that they identified for this group was lack of employment, high school education or lower, access to firearms, and illicit drug use. So again, risk factors for those that most likely might kill in an intimate partner violence situation. Dixon and colleagues in 2008 looked at 9 perpetrators and came up with their research here for prediction of homicides. And then taking their research and applying that to the Holsworth-Monroe classification. You can see there 25% incident rate for combinations or combining those classes. And the higher rate of IPV, according to their classification, higher categorization for murdering their partners. Adams in 2009 did some interesting research. Again, looking at typolicies, and really identified in their survey jealousy, substance abuse, people that were materially motivated, if they were suicidal, and also a career criminal or had a career history, I guess, of criminal activity, were more likely to be murderers. They hypothesized that perpetrators learned distrust from family, they were a child exposed to abuse and violence, and they had anxiety and insecurities that led to a pattern of difficult intimate relationships. Another topic in the Burgess book that we will address and have a discussion question related to is honor killings. There are many patriarchal tribal customs originating in Muslim, Sikh, Hinduism cultures where a father or brother may murder their wife or daughter to restore the family's reputation. These families are honored. They're honored to murder a family member. Most of the time it's women, for purification and maintaining respect within the community. This has also become, the battered women's syndrome has become a defense in cases where, for instance, a woman kills her husband or partner. This started in the 70s and 80s, used as a strategy in court to justify, I guess, their killing of the spouse that was abusive. In 1990, the Supreme Court in Canada actually accepted this as a legitimate method of self-defense. And then there's been ongoing legal issues stemming from the fact that the murders did not typically occur while they were being assaulted. So the women didn't fight back during the assault, but they were killing their husband later. And then that caused issues that were they really protecting themselves because it didn't happen while they were being assaulted. A few intervention programs for IPV, and this is again a discussion for this week. And it really categorizes looking at child witnesses, what do we do to protect them, and victims of violence, and then the batterers. So really intervention, where do you start? And the book really identifies three main areas that need to be focused on. Obviously, safety is the most important for children and the victims. Understanding normalization of feelings for children, that they're heard first of all, and then being unhappy, being depressed, being anxious, whatever the emotions, that they get validated. Children do best through play therapy, so they can act out that and role model good relationships. And then also working with parents or the people that they're in the homes with as far as parenting skills. So that overlaps with probably the victims of violence as well as the batterers. Victims of violence, again, safety, really looking at treatment programs. Are they effective to intervene and truly helpful to what the victims need? And then the ongoing support mechanisms, the therapy that they need. And again, being focused victim-centered versus just what other people or agencies decide they need to do. Batterers, the intervention for them best researched or showing success is the cognitive behavioral therapy, looking at attitudes of power, control, and violence. It's a combination of factors. None of these are shown to be 100% proof. And again, just the book discusses that it's not good enough just to talk to them about the way that they treat the women, that it's kind of a whole cyclical revolving around power, control, and any act of control, power, and violence. VAWA, Violence Against Women Act, was started in 1994 and has really been focused on all of these above things and commitment to improve criminal justice responses, expanding community services, and improving the measures and support needed for education and health-based intervention for these victims. This is the research study that we picked out to review. It is by Shorey and colleagues from 2012, Prevention of Mental Health Problems in Men Arrested for Domestic Violence. And I'm not going to read, there's quite a few slides on it that summarizes it very good. We would hope that you would pull up this article and read it, but again, we've done a very good job for you summarizing the article. So if you can't find it, you have pretty much all the information here. So it's really looking at mental health disorders and the correlations or association with increased male perpetrator IPV. There were 308 men arrested for DV and referred to a batterer intervention program. The mean age, 31.1. You can see here the race breakdown. Marriage breakdown was pretty equal, married and not married. Dating and single, separated versus divorced. The methodology are looking at aggression, physical assault, psychological aggression, and sexual coercion were the subsets that were examined. It was utilizing a 6-point scale to rate their abuse, 1 being once and 6 from 1 to 6, so 6 equaled more than 20 times. Higher scores indicated more frequent aggression. You see a typing error there. So the balanced inventory of desirable responses was used, again on a 7-point scale, 1 with not responding and 7 being very true. And it looked at tendencies to intentionally distort their self-image in order to be perceived as favorable. Higher scores indicated a more socially desired behavior. Another questionnaire that was used was the Psychiatric Diagnostic Screening Questionnaire. So it looked at different types of mental health diagnoses or problems. Participation was voluntary with no compensation. That's important in research so that they weren't bribed or paid off. No information was shared with the people that were facilitating the research or the criminal justice system. They did consent to participate. The whole process had IRB approval. If you know much about research, that's standards of quality research. The results showed that all 3 forms of aggression, physical, psychological, and sexual, were significantly associated with one another. Social desirability was significantly and negatively associated with reports of aggression perpetration. Social desirability was also significantly and negatively associated with all mental health variables except PTSD and the panic disorder. And they were all forms of aggression were associated with all the mental health variables except for panic disorder. Prevalence of mental health disorders. You can see here the depression, PTSD, panic, social phobia. Real similar numbers. The males meeting a cutoff score for depression perpetrated significantly more psychologically and sexually. Those with a cutoff score for PTSD perpetrated all 3 areas, psychological, physical, and sexual. Panic disorders, more so with physical aggression. Social phobia perpetrated more on sexual aggression. General anxiety disorder did not perpetrate more of any form of aggression than males who did not meet the cutoff. So just if you're into mental health, very interesting, specific to any of the mental health disorders. Males who met the cutoff for alcohol disorders perpetrated more psychologically and physically, and males who met the cutoff for drug disorders perpetrated, again, on all 3 areas. So it's difficult to determine from this research whether there's a relationship between IPV and specific mental health disorders, or if there's specific problems seen with all the disorders. We could see that there's kind of a trend they may vary between 1, 2, or 3 of the types of abuse, but all the mental illnesses were perpetrated for some kind of abuse. The mental health problems were self-reported rather than clinician ratings, so the participants, self-identified them with the mental health disorders. So more structured interviews might be needed. There's been a narrow focus on mental health issues and correlation between IPV. You can read through this, the research recommendations. And again, validating this research for specific mental health problems and IPV correlations. And then also, again, looking at IPV rates that might be higher because they tend to be underreported. And people, both abusers and the battered, the victims, want to be socially desirable, so oftentimes don't divulge everything completely. These are your topics for this week that will be on the discussion board, and I'm not going to read them to you. You can read them and you'll see them again, but basically summarizing battered women's syndrome, looking at treatment solutions, both with either your organization and or your state, and then taking that and looking at how you could make those better suggestions. Make these very personable to you, your agency, or your state. And then the last one is related to honor killings, a specific case that you know about, and discussion related to the outcome or interesting information. These are the references that we used. Again, the Burgess, this was a summary from the Burgess, Ruggers, and Roberts text, but also other research that was incorporated or additional specifics, so it's easy for you to find the research. And we thank you for listening. Please carry on a discussion and ask any questions that you might have.